Good morning, student doctors. Welcome to my CPR2 Pulmonary lecture, Drugs to Treat Influenza. My name is Jeff. Let's get started. Here are your learning objectives. Drugs to treat influenza for each drug. Mechanism of action, indications, contraindications, adverse effects, cautions, black box warnings, metabolism. Common examples of drugs in this class include neuraminidase inhibitors. The neuraminidase inhibitors I'll treat as a group. Oseltamivir, inhaled Zanamivir, IV Peramivir. We're also going to talk about two other drugs called baloxavir and amantadine. The mechanism of action are common amongst this group of drugs. Clickable links that'll take you to some of the reference material I used to create this lecture. What you'll find is highlights of prescribing information, all kinds of good information, a nice table of contents. All of these drugs competitively inhibit viral neuraminidase enzymes. These drugs prevent viral reproduction by budding from the host cell. First, let's look at the situation in the condition of A. There's a budding virus post-infection. Neuraminidase cleaves the receptor that holds the virion in place, releasing new virion, and you get continued viral replication. In B, in the presence of neuraminidase inhibitors, there's no virion release. These inhibitors prevent the cleavage receptor containing sialic acid. Student doctors, please note that this link is also clickable. This link will take you to a New England Journal of Medicine article entitled Neuraminidase Inhibitors for Influenza. The main differences in these three drugs is their route of delivery. It was the first neuraminidase inhibitor available by mouth and was listed on the WHO's list of essential medicines, more than 3 million prescriptions. It's indicated for the treatment of acute, uncomplicated illness due to influenza A and B infections. Patients that have been symptomatic for no more than 2 days. It's indicated in high-risk group. Oral Oseltamivir is indicated in the prophylaxis of both influenza types A and B in patients 1 year and older. Viruses change over time, particularly coronaviruses. There's emergence of resistance. Amino acid substitutions could decrease the drug effectiveness. Changes in viral virulence that also might diminish clinical benefit of antiviral drugs. Any patient who's hypersensitive to the drug should not be given Tamiflu. Other contraindications for Tamiflu adverse effects, you can see them listed here. Flu can cause these changes. These changes are more likely in children. Getting the flu virus is a risk factor for acquiring bacterial infections. When prescribing Oseltamivir, you don't want to give your patients an antiviral drug together with live influenza vaccine within 2 weeks before or 48 hours after. This drug is not a substitute for early influenza vaccination. Pediatric patients, it's not indicated to treat flu in children younger than 2 weeks of age, nor as a prophylactic in children younger than 1 year of age. With respect to breastfeeding, this is a USDA pregnancy category C drug. Animal reproduction studies have shown adverse effects on the fetus, but there are no adequate or well-controlled studies in humans. Very high doses in animals, this drug does cross the placenta. You have to weigh the potential benefits against the potential risks. These drugs do not appear to interact with warfarin, though this question is still under investigation. Oseltamivir is a prodrug. It's activated by carboxylesterase 1 enzyme. Activation of Tamiflu is inhibited by clopidogrel. There are no black box warnings with it. The prodrug is the phosphate form, whereas the active metabolite is the carboxylate form. Zanamivir, powder approved for oral inhalation treatment of influenza A and B viruses. Patients 7 years of age and older have been symptomatic for no more than 2 days. Bioavailability of Zanamivir is 2%. It's concentrated in the lungs, excreted in urine. As of 2009, no influenza had shown any signs of resistance to this drug in the U.S. Bird flu influenza type A, called H7N9, some folks in China who were infected with this virus expressed resistance to Zanamivir. This drug is contraindicated in patients with lung disease or breathing problems. There are numerous adverse effects that are rare but serious. Additional adverse effects occur, but these are less common. Warnings and precautions associated with this drug: bronchospasm, abnormal behaviors, especially in children and teenagers. The CDC recommends women who have suspected or confirmed influenza infection receive prompt antiviral therapy with Tamiflu or Relenza. Both are relatively safe for use by pregnant and breastfeeding women, pregnancy category C. Zanamivir is exclusively eliminated from the body via the kidney and undergoes no metabolic biotransformation. This drug is not a substrate for cytochrome P450 enzymes. The third drug in this class is intravenous Peramivir. Bioavailability of this drug is 100%. What I truly want you to remember is that all three of these drugs are neuraminidase inhibitors indicated in the treatment of acute, uncomplicated influenza patients who have been symptomatic no more than 2 days. Okay, student doctors, that's it for neuraminidase inhibitors. And this is a picture of cells I grew in my lab expressing GFP and RFP tagged proteins.